Hello, everybody. So we are live. So good morning, good afternoon, and good evening, everybody, wherever you are joining us from today. So my name is Meg, and I'm part of the Fixed Social Media team. And today we're really fortunate to be joined by Dr. Robert Silverman for a fantastic live session on low-level laser therapy and how it can be used in sports chiropractic and how it can be applied to your practice. So thank you so much for being here with us, Dr. Silverman.
It's my pleasure. I'm excited to be here, and thanks for getting up so early and joining us.
No worries. So if you're just joining us, I've just introduced myself. So my name's Meg, and as I mentioned, I'm part of the Fixed Social Media team. And today we are really fortunate. We're here with Dr. Robert Silverman. So if you're watching us on YouTube, I'm just going to say this again because I noticed we were a little bit delayed to connect with Facebook there today. And yes, so we're really fortunate to be joined by Dr. Silverman today, and we have a fantastic live session on non-thermal low-level laser therapy and how it can be used in sports chiropractic and how it can be applied to your practice. So Dr. Silverman is a chiropractic doctor, a clinical nutritionist, an international speaker, and he's the author of the Amazon #1 bestseller, Inside Out Health, a revolutionary approach to your body. And his extensive list of educational accomplishments includes 6 different degrees in clinical nutrition. So he maintains a really busy private practice as the founder of Westchester Integrative Health Center, which specializes in the treatment of joint pain using functional nutrition, along with cutting-edge science-based non-surgical approaches. And he is also one of the star speakers at our upcoming Fix Symposium, where he's giving a really great breakout session on epigenetics in sports performance. So Dr. Silverman, you're here with us live today. So feel free, everybody, to ask questions if you'd like in the comments, and he'll answer them for you. And he's actually speaking to us today on behalf of Erchonia Lasers, who are the world leaders in low-level laser technology and who have just joined the Fix family as our newest sponsors. So as I said, thank you so much for being here with us today.
Thanks for having me once again. I'm excited. And by the way, I'm very excited about that. I think it's May 9th where we're going to talk about epigenetics. But for today, I'm really happy to share some key insights on what low-level laser is, how it works, and I'm actually going to do a demo. And I do want to piggyback on what you said. Anybody who has a question, feel free. We're going to answer all the questions. We're going to make this as extemporaneous as we can.
Fantastic. Well, I will hand over the floor to you then, Dr. Silverman.
Terrific. I look forward to it. So I want to talk a little bit today about how laser therapy can apply to your practice. I'm going to share some interesting insights in the next 25 minutes on how laser therapy can heal the body. It heals the body like no modality that I've ever used before. I'll go over the safety of low-level laser therapy, how quick it is in speeding up sports injury recovery, less fatigue, prehab, and rehab. And I'm going to demo specifically the head, neck, and shoulder region today. So people use the word laser. It's very interesting. Most people, what is laser? Well, it's actually an acronym. It means light amplification by stimulation emission of radiation. It's a focused beam of light that emits photon energy. All the photons have to travel in the same direction at what we call the same wavelength. When you have this perfectly colored wave, it's called coherent light. And that is a critical key nugget to the effectiveness of using non-thermal low-level laser. Some other people want some synonyms of low-level laser. Here's a few. Photobiomodulation, if you want to Google it. Low intense light therapy. The key component is that it's photochemical and not thermal. You don't want a laser that provides heat. Heat can be, without question, deleterious to structures. Photochemical is not deleterious. The key takeaway, or what I like to talk about, is the electromagnetic transfer of energy. And I'm going to show you. The light, the photons trigger biochemical changes within the cells. When I talk to my patients, when I talk to my athletes, I like to compare it to photosynthesis in plants because photons are absorbed by cellular photoreceptors and trigger chemical changes in the body. So light is directed to the specific site. I want to give a little background. I want everybody to know, I know it's the first introduction for many people in laser. So when I direct the light at the effective site, these photons enter the tissue. They actually alter cell permeability. One of the key components is the health of the cell membrane. So cellular photochemical reactions actually are absorbed into the mitochondria, the powerhouse of the cell. What body part has the most mitochondria? You got it. the brain. In addition to that, that stimulates obviously ATP, oxygenation, and neurotransmission, leading to resulting effects like increased metabolic activity, vascular activity, and decreased inflammation. So when my athletes come in and say, what are you doing? What am I getting? Here are two key takeaways, docs, that everybody needs to know. I'm doing one, increasing cellular regeneration, and two, increasing cellular communication. So increasing cellular regeneration due to the efficient ATP production. So I know every chiropractor, every sports chiropractor right now is saying, what does that increased efficiency of ATP production doing? Well, yes, without question, it's going to increase performance. The second dynamic is increased cellular communication, improving because the body is all interconnected, speaking through the cell membrane, speaking through the nervous system. So we have two types of lights that we're going to demo today. We have a red light, which is a nanometer light, a 635 red nanometer light. It allows, once again, to positively affect the mitochondria. It has a pain relieving effect. It accelerates tissue regeneration. It also allows for the stimulation of cell metabolism. It will show accelerated wound healing, increased lymphatic flow, and it also has this fabulous physiological effect. So if I will, some of the benefits of laser therapy, very simply, non-toxic. There's virtually no contraindications. It's non-invasive. It's easy to apply. It's extremely safe. It has a high efficacy for patient conditions. More so than that, it holds multiple, what we call in America, FDA clearances. Once again, to reiterate earlier, it enables you to have rapid cell growth, increased wound healing, increased metabolic activity, reduces fibrotic tissue formation, has an anti-inflammatory action, increased vascular activity, and can increase the action potential on nerves by stimulating the nerve function. So let me do a little something and let me get in here. I want to come up. I want to make sure my camera shows me everything. And here you go. Here is your laser. Look how easy it is. I'm going to press start. And here we go. So I want everybody to see that I have a red light here. So this is a 635 nanometer light. That 635 is what we call the visible light. Now, this 635, I'm going to go over some of the properties, really has worked fabulously in a musculoskeletal light for my athletic patients. So once again, the red light 635, it can go through the skin if you want. You can put it right on the skin. I'm using it in all different areas. And once again, the 635 is the visible light spectrum. So let me go back in here. And now I want to demo the EVRL. I just want to show you the EVRL is very unique because it has a dual purpose head. It has both a 635 nanometer and it also has a 405, which appears to be a violet light. So if I am to turn this one on, and please, I encourage you to ask some questions. I'm happy for you to ask some questions. I know Meg will let me see them. So as you can see, now we have a dual purpose light. We have both a red and a violet light. Now the violet light is a 405. They both have different properties. The 405 is vastly different than the red light in that the 405 is antimicrobial, antibacterial, antifungal. So it's really anti-pathogen. It also works with the sympathetic nervous system. The red light has a more musculoskeletal outcome. When you combine the two, then that's what I use. I happen to use this EVRL virtually all the time. When you combine the two lights, you get the synergistic effect of the two properties. So I want to go back here and really talk about that visible light spectrum. You just saw me demo putting it on. I'm going to go through some real movement demos in a moment. Number one, remember the 635 is the therapeutic sweet spot on the visible light scale in nanometers. One of the key components to laser efficacy is the wavelength. The EVRL, the violet portion, is a 405 antimicrobial. So once again, let me really show you the distinct difference between the red and the violet. And when you combine them, you're going to get both that synergy. Number one, the 635 nanometer increases energy flow, and dissipates energy if it's too high. It enables you to promote increased energy through the stimulation of the mitochondria. It has an anti-inflammatory effect. It enhances ATP production, efficiency, protein synthesis with pain reduction. It's shown to create improvement in collagen formation and wound healing. It also enables you to reduce pain and muscle spasm while increasing strength and range of motion. It's shown the ability to balance the parasympathetic nervous system and enhance microcirculation of blood and lymph, and it balances cell-to-cell communication. Chiropractors, we know the body's all interconnected. We know that because we started our learning process through the central nervous system, obviously the peripheral nervous system, and now we know through fascia and other systems that the body is all interconnected. So any kind of stimuli, the whole body communicates. The 405 violet light is very interesting in that it stimulates more the sympathetic nervous system. It helps the body's defenses to eliminate bacteria, viruses, and fungus. Clearly, at a time where we're talking about viral pandemic and cleanliness, this violet light comes in quite handy. It also increases the sympathetic response. So once again, I've been quoted as saying the violet and the red light dynamic together works in a synergistic fashion and has enabled me to reach clinical outcomes that I didn't think were possible. For me, also, if you will, look at its mobility. Look how easy it is. I can hold it. I can hold it. I can carry it with me. I'm not supposed to do that. Sorry about that. I'm going to stand up and just put it in my, it's all right. I'm standing my, put it in my pocket. It's just, it's just that easy. So here it is. My social media team here is freaking out because I almost pulled out the plug. So you have to have a little fun when it's raw like this. I want to go over a study that I did where I was the lead clinical investigator. And the study was the effects of a single treatment with 2 non-thermal laser wavelength on chronic neck and shoulder pain. We took the 635 nanometer and the 405, so we used this. The patients had to have pain over 30 days. It was a 1 treatment challenge for 13 minutes. The visual analog scale was used. It was used 3 minutes after treatment, 24 and 48 hours after. There was a predefined 30% decrease for 65% of the subjects. The results were stellar. 75% of them achieved over a 30% decrease in the visual analog scale of pain. The score remained high at 24 to 48 hours. What was most noticeable was the secondary efficiency. There was a change in range of motion. Patient satisfaction improved. The conclusion to the study was as simply as follows. Overall, treatment with the red-violet laser outperformed many other FDA-approved red lasers with respect to change in pain scores and increased shoulder range of motion. In my sports genre, I have a sports-based functional medicine practice. I did a separate study in my own office on some specific sports injuries. One of the most common, obviously, is an ankle sprain, the most reoccurring. Concussion, and I did rotator cuff. And the difference was astounding to me. I mean, without question, the laser is one quilt to multiple options to help sports injuries. This one worked fabulously in that I saw a 20% increase outcome with about a 30% decrease in time versus other laser type modalities. So the combination of the red and the violet was a huge takeaway for me. Some of the ideas that I like to share with you, that I share with my high school, college, and professional athletes is the concept of prehab. The idea of prehab, you want to prevent future injuries. You want to improve musculoskeletal responses. You want to reduce musculoskeletal stress and lactic buildups. You want to pre-roam and get that muscle ready, but more so than the muscle, you want to get that central nervous system ready. And you do so by using the laser because it communicates with the nerves, and that's going to enable you to lubricate the muscles, the joints, and get the person ready. We always said that there's muscle memory, but it's truly central nervous system memory, and that's a laser nugget. You want to decrease pain and increase range of motion from previous injuries. How many times has someone come in and I tweaked my ankle, I pulled my back, but I'm here for a performance type of treatment. Now, we all know that those athletes, we're putting them together every day and nothing is going to stop them. The idea of implementing the laser also allows you to naturally improve athletic performance through assisting in this type of response-mediated laser. You can motivate and improve the psychology of the athlete just from them knowing that they're going to perform better. Of course, you want to extend their athletic productivity, and you want to restore the system balance, the central nervous system, the balance between the parasympathetic and the sympathetic nervous system. And you get that with the red and violet laser. What's most interesting is the increased muscle contraction post usage of the laser. Because of the ATP, oxygenation, and neurotransmission, people perform better. Simply me going to a CrossFit as a great example. I go once a month and I always ask everybody, who wants to PR, get a PR? And people raise their hand and say, okay, what did you do on a deadlift last time? What did you do on your clean and your jerk, et cetera, et cetera. And I laser them, and almost to a T, everybody hits their PR. I do it with myself in my own home gym. The bottom line is that once the athlete feels this and sees the performance, without question, this is going to be practice enhancement, without question. Some studies I want to go over before we do the hands-on. Low-level laser was used in an intense progressive running test of high-level football or soccer players from America, football players from overseas. The conclusion was to pre-exercise, to use the laser in a pre-exercise mode and to be able to improve different functional aspects related to, number one, these are the improvements, athletic performance, biochemical markers related to muscle damage and inflammatory process to high-level athletes, and decreased exercise-related oxidative stress. So the idea of using the laser in a sports genre for prehab is a critical element. Most people don't prehab. We're reactive. We're being too reactive. We're not being proactive. Prehab is a great choice. In addition to that, what I found with laser therapy for sports performance and recovery. So we've got our prehab, we've got a performance, and we've got a recovery. It gives a distinctive advantage in sports performance. Talked a little bit about it before, about, just at a lower level, walking into the CrossFit and enabling them to reach PRs. My pro athletes come in and go, can you tune me up? Can you upregulate me? So participants are lasered before and after exercise. There was a study done in December of 2016 where human muscle tissue was biopsied, and they found out that athletes who were lasered before and after had a decrease in fatigue, had an increase in number of reps, had muscle hypertrophy after training, decrease in inflammatory markers, these old blood markers, biopsies, decrease in oxidative stress. They had an increase in creatine, and delayed onset muscle soreness was found that when they used laser, ice, all these other optional modalities, which are quite effective, they've stood the test of time. They have a proof of concept. The delayed onset muscle soreness, laser was the best modality for enhancing restitution of post-exercise 24 hours faster in its recovery versus the other type of modalities. So once again, you're looking at prehab, you're looking at injury, and you're looking at performance. In another study that I saw in 2016, there was high-level rugby players were studied. And the results were simply low-level laser therapy significantly decreased the percentage of change in blood lactate levels and perceived fatigue. Can lasers make you stronger? Well, I told you that I saw a lot of PRs, but here's another study, a different study. In 2016, 2016 was the panacea for good quality sports laser studies. And I'm just going to take this, a quote right from the article. With an apparent lack of side effects and safety due to no thermal damage to the tissue, we conclude that the application of phototherapy yields enhanced strength gains when applied before exercise. The application may have additional benefit value in post-exercise rehab where strength improvements are without question needed. And I just want to end with this before we get to the demo and ask some questions. Here are the components that allow the laser to be beneficial in a sports genre. Number one, the active ingredient. Always remember the active ingredient is number one. The 635 and the 405 wavelengths, as I said before, and I'm happy to write a follow-up post on them. They show different properties. The 635 on its own shows without question to have a lot of musculoskeletal and nerve function. The violet light shows to have antimicrobial, works with the sympathetic to allow the two systems to align. Also, the violet light, and if somebody asks, if you ask, I'll do it. I will show you a vagus nerve stimulation. The dosage. The reason I call it low-level laser is that it should be low-level in its power. You don't need a lot of power. It's not about power when it comes to laser therapy. It's about absorption and the delivery mechanism. The light should be coherent. It should come from a laser diode. And lastly, there should be pulses, and you'll see that it's pulsed. So, Meg, I'm going to ask you before I do demo, do we have any questions? Because I couldn't see any.
Sorry, I had muted myself because there's a train that comes by at 6 a.m. in the morning. But no, so we're all good for questions on this end. But I do know that a lot of people do watch the replay. So if you do have questions, feel free to drop them in the comments at any time, and we'll connect with Dr. Rob Silverman and we can answer them. But I think we'll kick over to the demonstration.
Yep, absolutely. So what I want to do is I want to demo something on the shoulder, and I want to demonstrate something on the head. And I will do a quick vagus nerve. I know it was rapid fire. You know, guys, I'm from New York. We love to give information in a rapid form. So are we ready? I guess so. Okay. So we're going to do that right in here. So Stephanie's going to come in. Stephanie, wave to the world. Hey, everybody. So what's most interesting is that very simply in a typical case study or a typical approach, so we would, without question, just take the laser and start with a very easy approach. So I just turn it on, and I would laser in her neck area. Actually, thank you. So this is for someone who may have a little stiff neck, laser just in the local area. We start with the dermatome or the area of involvement very locally. Then I will move her head. So we're going to do area of involvement, passive movement, still lasering. Now, one thing you'll notice is I'm always moving the laser. I'm a big proponent of the motion of the laser. Have her drop her head back. This is just for a simple little neck. And now I'll ask her, Steph, you don't mind if you just drop your head forward? So she'll drop her head forward. As I laser the whole area, can you bring your head back? So remember, we're using the laser, just in neutral now. We're going to use the laser, area of involvement, or dermatome. Number two, passive movement. So I'll passively move her. And then I'll ask the athlete, the patient, to actively move. So could you do that? And that's the local area. Now, for the shoulder, it would be real simple because let's say she comes in with the typical thing, it hurts right here, Dr. Rob, it hurts right here. So here we go. It would be right in the area. And then I would have her move because we know that I tested for some supraspinatus movement. So I'm going to move her so I can engram the proper movement. And then I'm going to drop down. And Steph, do you don't mind if you can do that? Great. So we'll just have a hold, go in here. Now, I promised you the vagus nerve, so I'm going to give you the vagus nerve. Why would I do the vagus nerve? You know what? I'm going to do it on my own because you can't see me. Thanks. So vagus nerve, cranial nerve number 10, the great wanderer. The vagus nerve has lit up so many athletes in a positive light because it's a bidirectional communication between the gut, the brain, and the brain and the gut. Having said all that, the vagus nerve responds really good to the violet light, and I'm sure you're going to have some questions on that. So I'm going to use the violet and the red in this instance, and I'm going to go from the medulla oblongata, and I'm going to move down through the transverse colon. You can only use the EVRL from me in the violet light. The medulla oblongata, both sides, down through the transverse colon. Why are you going to do that? Because once again, the bidirectional communication between the gut and the brain. How many of your athletes have had a concussion? How many of your athletes have hit their head but not a concussion? We now realize that so many athletes are suffering from inflammation in the brain. The microgills are lit up, and we need to decrease that inflammatory process and also reconnect the communication, because whatever you do to your brain, you do to your gut. Whatever you do to your gut, you do to your brain. So before, if there are any questions, I did want to go through one case study. It was a fascinating case study, and this will take you through the beginning essence of what the laser can do. And it's very simply, a very well-known athlete came in with an ankle sprain. I mean, how many times have we all treated an ankle sprain? This is this individual's 5th ankle sprain in the last 7 months. So obviously it's a recurrent ankle sprain. And we all know the number one reason for recurrent ankle sprain is the lack of proprioceptive feed and lack of proprioception. And I discussed it. This is the first time the athlete had come in, and we discussed the idea of proprioception and, healing the joint and allowing the body proprioception to balance in space between your nervous and your muscular system. And they were doing balance training, one-legged training, and it wasn't really working. So I took the laser. I did what the chiropractors do. I do active release, instrument assisted, worked on the soft tissue, the reticulum, adjusted the associated joints. Things were moving in the right direction. I lasered the area, and that laser, that changed from the other modalities that we used previously with these lasers, really allowed the structures to contract appropriately. The hidden gem with these lasers is that I can laser the cerebellum, which has 50 to 90% of the nerves, and I was able to upregulate the proprioception while they were doing balance boards, one leg, really got the clinical outcome that I was looking for. So in that very easy case study, I just lasered the area. It was obviously a lateral ankle sprain, which is your typical inversion sprain. I lasered the area. Then I lasered the everters, everybody, because obviously the everters, if they're shut down, won't allow the inverters to hold tight. Was able to laser the brain. Anybody have any questions, you can ask. I will do a follow-up video sending it in. And the last one, before I bring Meg out, because I want to keep the constraints of time appropriate, I had a patient come in, and it's not a world-class athlete. It's a 12-year-old rock climber. And they've had 5 concussions, because every time they do their rock climbing and their ninja stuff, he's fallen and hit his head, and he's had 5 particular concussions. But the point is, the woman came in because she knows that I have the laser and the techniques based around the laser for concussion and to treat concussion. I believe that it works fabulous in my office. But the real segue was, we were treating a concussion, and I noticed, and I looked at the young boy's hands, and I said, he's got a lot of psoriasis there. And she says, yeah, he does. He has a lot of gastrointestinal issues. Beep, 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 red light. Whatever you do to your brain, you do to your gut. Whatever you do to your gut, you do to your brain. And I said, did he start to get them after his concussion or concussions? And she said, yes. So then, once I started with that vagus nerve stimulation, changed the person's diet a little bit in conjunction with the patient coming in for the laser, I then got some clinical outcome that other doctors weren't able to, because the vagus nerve is so robust in its outcomes. So Meg, let me know what you got for me. We're at the 29-minute mark.
Perfect. No, thank you so much for your time today. It looks like we're all good on questions for today. But as I said, anybody watching, feel free to ask questions as you're watching the replay. We'll be monitoring the comments for the next, forevermore. But so do you want to quickly let us know where to find more information about lasers for kind of more interest? So obviously, erchonialasers.co.uk or erchonia.com, depending on which region of the world that you're in.
Absolutely. Simon Ramshaw runs Erchonia in Europe. He does a great job. I wish he could come up here. He would do a great job in explaining everything. You can reach out to him. You gave the website, and we've got Erchonia in America, where I am. And a lot of people ask me about the laser and why. We're chiropractors. We do everything by hand. So obviously this is done by hand. You saw me press a button. It was easy. By the way, it's really light. And the reason I got the laser, and I'd like to end with this, is that I have congenital torticollis. Now, growing up in a tough area in New York, having congenital torticollis, we'll just say there were a few scrapes and bruises along the way because people didn't understand what it was. So about 12 years ago, I needed something because I could no longer take a cervical adjustment because of my neck fusion. And I got a laser to treat myself. And I was very happy with the results. Then I treated friends and family, put it in my practice, and really revolutionized my practice. So the takeaway really is that I've used the gem, the laser, that's taken my individuality, saved me, and also taken my patients to new outcomes. And I love to use it on my athletes because the athletes, without question, will notice the change immediately because nobody's more in tune with their body than the athletes.
Fantastic. And I've put the URL for Erchonia on the screen and in the comments for anyone who would like to just very easily click through. But I can't let you go just yet because you are also giving a talk at our upcoming Fix Symposium on epigenetics in sports performance. So we'll do a quick shout out for that. Can you give us a quick 30-second overview of what people can look forward to for that?
Absolutely. Epigenetics in sports performance. Genes are not your destiny. It's your environment. It's what you do. There's no excuse. So I'm going to explain to people how changing their environment and how to test for a genome can lead you down a path of increased athletic performance. And I'm going to utilize specific nutritional protocols, laser protocols, testing protocols, and it was without question an interesting theme. So just remember, genes are only 10% of your outcome. There is no excuse.
Fantastic. And anyone who would like to register for the Fix Symposium, you can do so over on our website, which is fix.sport. But thank you so much, Dr. Silverman, for being with us today and taking the time. And as I mentioned to everyone watching, sorry. I'm
sorry for interrupting. I see one question. It's a great question. Can you tell the difference between a true laser diode and an infrared and an LED? So essentially, people always ask, I'm not sure laser. Well, number one, true lasers don't generate heat. That's number one. LEDs are light emitting diodes. They're a little different. They're different because they're maybe monochromatic, but they're not coherent, but that's too technical. LEDs, the takeaway versus lasers, are 7% as effective and can generate heat. Infrared, you could be sitting under one. You want a true laser diode. So the question is, when you look at a laser, is it a true laser? Is it FDA cleared? And try and look for some testimonials. Hey, I'm sorry you put the question. If I told you I could read it. Sounds amazing. Looking forward to it. Thank you very much, Chanel. I'm looking forward to it also. This was our introductory. Meg is fabulous. Nobody does a better job at social media than her. She let me talk, and, I appreciate it.
Well, it's funny when you knocked the computer, I was laughing for a minute because I'm like, oh, they might have to put up with me for the next 20 minutes when you were saying that you'd pulled the cord. We have one more question from Chanel. Chanel said, what laser do you use? What do you think of BioFlex?
Okay, so the laser I use is a Erchonia laser. In the handheld version, I brought two. I'm very happy to show you some others. But number one, here's the Accelerate. Love my Accelerate because it's a handheld, as you see, red laser. So it works fabulously, great for musculoskeletal, has an FDA clearance for decreased pain and increased range of motion. The one that I use all the time, this is my baby. I go nowhere without it. I won't even go on vacation with my wife without taking it. It's EVRL, Erchonia Violet Red Laser. So obviously you guys all know I use Erchonia in my office extensively. It's got a red and a violet light. The red light is a 635 nanometer light. Once again, you're also adding the 405, and that is really the sweet spot. That's the gem, if you will, because the 405 is antimicrobial, antibacterial, antifungal. When you combine the two, you're not only getting a balance of the autonomic nervous system, you're also getting all these properties. The best way to look at it is 20% increased outcome, 30% less time. So I use the EVRL. Can't comment about somebody else's laser because I don't know all the other lasers. I just know every laser that's been in my office that I've tried, this one won.
Fantastic. Well, thank you so much, as I said, for your time today. We won't take up any more of your time, but feel free, everyone watching, to connect with Dr. Rob Silverman, to connect with Erchonia, and you can also catch Dr. Rob Silverman again at the Fix Symposium. So thank you so much for your time today.
Thanks a lot. My pleasure. Dr. Rob, always yours in health.